Welcome to Frankly Speaking with Dr. Wade. This show was created for and inspired by the thousands of patients I've served, so it's time for me to speak up and speak out on their behalf. With a wide range of experts, we bring you weekly insights, diving deep into topics of controversy to bust through the sugar coating that keeps you and your family stuck in the mainstream.
I really, if I can help one person, that's
live.
Awesome.
Hey, everybody. Thanks so much for joining us today. I'm here with Katie Rail. She is an incredible mom who has inspired me along the way, as well as many other people that know her, with her willingness to learn, her sharp as a tack, awareness, and how hungry she is for knowledge. So, Katie, thanks so much for being here with us today.
Thank you for having me, Wade.
You bet. So tell us, and just tell our viewers here specifically and listeners, what is your story? Where did you come from? In other words, first of all, how did we meet in your version?
So Wade and I met through a work client of mine, and I knew Wade for a couple of years, and he just adjusted my client, and eventually I was able to tell you bits and pieces of my story, and you said, hey, I think we can help you here. And, I was a little unsure, but once I started, even just starting getting adjusted, I started to notice a huge change in how I was able to listen to my body even better, and to understand how it functioned a little better, and to know where I was off. And from that, then I wanted more knowledge. I wanted to know, I knew I was missing nutrients in my diet. I knew I was missing minerals and vitamins, and I don't have an appetite all the time. And so what can I do to get those in my body and to start healing my body? Because the medication that I'm on it's not there to heal me. It's there to keep the symptoms at bay.
Interesting. So, and that's kind of how simple it is. In many cases, we interact with folks along the way at various times that don't realize there's other options. Can you tell me, first of all, folks, if you're comfortable with that, what you went through, when it started, and how that started to paint your life? What did that behaviorally or habitually, where was it taking you?
I would say in 2009, I started to get really odd symptoms. Almost like I was menstruating, but there was no period menstruation coming. And then I started to correlate that I'd have to go to the bathroom, and it would happen right after I ate. So subconsciously, I stopped eating. I was just okay. Well, things got worse and worse. And in 2010, I went to the emergency room, and they kind of told me I was nuts. There was nothing wrong with me. And then I went to my GP who birthed me, and he knew I don't just go to the doctor for any reason. He knew me as his patient and was like, something's wrong. And he ordered a papitis scan on my gallbladder. My gallbladder was not functioning at all. So at that point, they decided to take out my gallbladder. A day after they took out my gallbladder, I went to the bathroom, and it was all blood in the toilet, and it was really, really scary. And they ordered an endoscopy and colonoscopy the next day. And the surgeon who did that, I remember him telling me, I'm 99% sure you have Crohn's disease, but I cannot diagnose you. I have to pass that on to a gastroenterologist. And I was 20 at the time. I'm about to be 30. It was a really scary time in my life. I was sick. I had no energy. And I do a lot of work with, in-home therapy with autistic kids. And I needed my energy. I needed to feel and I was 20. I wanted to feel young. I wanted to enjoy life, and I couldn't. And shortly after that, in September, in 2010 of September, I was diagnosed with Crohn's disease from a gastroenterologist. And he said, hey, these are your options for medication. I'm not going to, and I asked, what should I be eating? Is there something, should I change my diet? And nope, you can eat whatever you want, whatever agrees with your body. And I thought that was strange. But we ended up going with Remicade infusions because at that time, which I realize now, I needed the Remicade. I had internal bleeding. I needed that medical intervention to jumpstart to get better. But I got stuck in just the fact that you're just supposed to take the infusions for the rest of your life, and this is how your life is now. And when I met you, my mind opened that there are other ways, and you can heal your gut with nutrition and eating right and listening to your body. And so over the course of, I'd say the last 2 years, I've really been working, and over the last 8 months, I've been working extremely hard on my nutrition and diet and taking some supplements, and I've noticed just amazing improvements.
Well, you've been incredibly special to work with along those lines. It's always fun when you're working with somebody who asks questions, who is not only hungry for knowledge, but to actually listen and apply this knowledge. I think that's what I would say every clinician would want, is your patients to be engaged in the process and actually, find that happy medium where you're doing what you need to do and you're still taking enough consideration into what's going on. And the caveat here that I just want to make sure we clarify. So people both hear Katie's awesome message as well as respect the fact that we're not treating, and I don't treat, quote unquote, I don't treat Crohn's disease. I don't treat that. And what we started doing with Katie specifically was adjusting her spine, and we can talk about that, but we can talk about how adjusting the spine and some of the testing that we do that I've been trained with, and some of the developmental technique that I've basically created over the years, is looking at the body holistically to be able to tell when other systems are actually creating the spinal challenges and the spinal misalignment and the chronic asymmetry or imbalance that the body has. So number one, I'm not treating Crohn's, but in terms of Katie doing what she needs to do for herself, and Katie, you get to give feedback on this, where this, where this is accurate or inaccurate, is she has, as a patient, the right to other options that support her health, not as a substitute to treat the Crohn's. I support whatever she's doing with her doctor, period. But Katie needs also, I think she deserves an opinion that puts her in the driver's seat, that allows her to take charge of her life. She's got a beautiful family, new mom, who's an incredible mom, seeing her unfold into this natural, awesome.
Thank you.
Yeah, you've been fun to watch there. But it's just, really just the consideration about how you're going about it. You're very calculated with this. It's like your life took this 90-degree turn and boom, you're just going this direction and succeeding so well and seeing what you're doing. Down the road, we can talk about what you've had to do with your son if you'd like. That's up to you to open that door. But
that has been just another amazing journey in itself, knowing that I have Crohn's disease, and I was very concerned about my son and that he'll get it or he will have to deal with this. And the fact that I'm educating myself to know that when he gets adjusted and when I get adjusted, it helps our body function at more of 100% level. So we're able to tackle the things that would maybe deter him into falling into some digestive health problems. And the fact that I grew him and that my body wasn't able to teach his body how to digest some things, I think has been it's really empowered me to want to make better choices for us. And I'm not perfect. I don't do 100% on my supplements every day. Or even for my son. I'm not, I'm a mom, I'm busy, I'm working. But I never let that stop me. I wake up the next day and I go at it again because I feel the positive feedback in my body and I see the positive feedback in my son. He's a content, happy baby. And it's awesome.
By the way, Katie, nobody's perfect with it. And that's not the point. The point is, where your body's improved. The difference is, can you just allude to your knowledge of where you are with your Crohn's, the injections, which when you told me this, I was shocked at how expensive and how frequent they happen.
So they happen every 8 weeks, and they are about $10,000 every infusion is. So I should, 10 years that's a lot of money. And it hasn't made me better. It hasn't healed anything. It did what it needed to do at a time in my life when I really needed it. But I'm getting more stronger in my feelings that maybe it's time for a change. Maybe we need to go down to a different medication that's not so hard on my system for a little while and kind of, like you said, put myself in the driver's seat and empower me and make, I don't want to make somebody else rich, I guess. And it's not helping me. It helped me at a point, but it's not doing what it needs to do for me anymore, I guess.
So shifting gears, because I'm not here to make something wrong.
Oh,
and
no.
Your choices, by the way, what I love, first of all, is your progress. You've made tremendous progress. And as you've done that, how has that, what's the difference between where you were 8-9 years ago when you first started this, we met, and a lot of the foods you were consuming? What have you learned about those foods that you were consuming while just getting the injections? What did you learn that they were actually, what kind of influence were they having on your body?
They were still inflammatory, and I was still going to the bathroom frequently. My stools weren't formed. I was eating a lot of junk, and I started to it didn't help. It wasn't helping any of the symptoms.
So how have you changed dietarily? What did you do? Give me like the top 3 things you've done that have had a great significant, from your standpoint, your body's feedback, where you've had great progress.
The biggest for me has been cow's milk. I gave up cow's milk, and I substitute with almond milk or oat milk. And I have noticed just 180-degree difference in my body just by giving up the cow's milk. And then I've kind of I've tried to be as gluten-free as I can. I'm not perfect, but we get there. It's baby steps. But I've noticed a difference in that and my decrease in sugar, because I've noticed when I eat, I love Kit Kats. If I eat a Kit Kat at 11 o'clock at night when I come home, by 9 o'clock in the morning, I'm sick. I don't feel well. I have to go to the bathroom, and it's actually painful. It's not comfortable. And so I've gotten a lot of feedback just by myself, by listening to my own body. And I'd say those are the top 3: cow's milk, gluten-free, and watching my sugar, because that does crazy things to your gut.
You're just speaking volumes to, there's a theme with those that do struggle and have a lot more inflammation in the body, and you pretty much hit a couple, three of the top markers. And so, and number one, I just want to acknowledge you for all the changes you've made. It's not always easy, but you stayed open to try them. And then you've gotten your own research, haven't you?
Yes. And it's motivating. Like, it is so motivating to like feel my body feel better and to want to keep feeling that. It makes me want to keep doing better and making better food choices and keeping at it.
Yeah, you're pretty powerful. You're pretty powerful. So, go ahead.
No, I was just going to say one more thing. I used to feel with my infusions, I was explaining this a couple of weeks ago to Dr. Wade, but I have like normal fatigue because I'm a new mom and I get tired. But when I get down to needing these infusions, I'd say like a year ago from the very beginning till about a year ago, I'd have an extra layer of fatigue, which I call Crohn's fatigue. And about 2 weeks before I need an infusion, I couldn't get out of bed. My muscles hurt. I was tired. I wanted to sleep all the time. Now with getting adjusted and working on my dietary stuff with my Crohn's, that has been lifted. There, like this, I still have normal fatigue, don't get me wrong, but the Crohn's layer fatigue is gone. And it's been amazing to notice with the last 2 infusions that I haven't had the symptoms leading up to an infusion that I used to have and that I would complain about. And I'd complain about to my gastroenterologist, and I'd be really crabby and not a nice person for 2 weeks before my infusion as well. And now I don't have those symptoms at all. It's mind blowing actually, to not feel that, and that I can make it all the way to 8 weeks or even after. So that's what's giving me even more fuel to want to find maybe a different medical path, and to know that there's actually choices out there for me to maybe move on to something else.
That's pretty cool. That's really cool. Thanks for sharing that piece. What advice would you have to somebody who's struggled with this and feels like there's kind of just one way, or they've gotten rather a mainstream allopathic or medical viewpoint on it, and they're pretty limited in terms of what options they've been given outside of, hey, you need to just take these drugs and manage your symptoms the rest of your life?
I would say do some research yourself. Also reach out to different providers and maybe go get a second opinion. That's something I never did until I kind of found you, and you started to kind of educate me that, hey, you have some choices here. I think when you first get diagnosed, it's kind of like A plus B equals C, and this is what you have to do, and they kind of make you feel really alone. So I say reach out to other people who have what you're dealing with, and try to get some information from them and see what they are doing differently, and explore and experiment with different things. It doesn't hurt to try.
Cool. What was one of the biggest things, because I don't know this after all the conversations we've had, but what was one of the, you talked about education in the gut healing and what your body's doing. So what made sense to you when we talked about the symptoms where there's so much inflammation in the body and then food? I mean, because you kind of started to put some things together, but you processed it. You listened and processed and listened and processed, and then you took steps at your own pace.
Yeah.
Do you recall where that kind of started to click for you? Because I remember you saying, I'm ready. I want to talk about this. I want you to tell me where this is. And without me
I want to say
projecting.
a lot of it came from my client I work with, and seeing him and how he processed his adjustments and his food, and just noticing improvements in his disabilities, and looking at myself and like, hey, like there's a connection here, like between his symptoms and this and me and this, and that made me want to dig deeper. And then after having my son, I would say that's probably the second biggest thing, was after having my son, realizing what the long-term effects of the infusions are, and knowing I want to stick around for my son. I want to be there for everything. And I want to make myself be the healthiest, best that I can be, so I can stick around for him. And continuing on the path of infusions isn't going to give me that longevity.
So, is there anything else you'd like to add or share?
If you're struggling like I have or was, I mean, I'm doing a lot better, but reach out and ask for help. And also, Dr. Wade is amazing. If you have the ability to contact him, or even somebody else in your area, more of a holistic doctor, see what they can do for you. See what they can answer for you. And ask specific questions related to your body, because I think I had to get really specific about my individual things, and then the light bulb started going off, like, oh, okay, that's what that is. Maybe I should back off on this. And so reach out, ask questions, and educate yourself. You are your biggest advocate. So go out there and, be your cheerleader, yes, because you're worth it.
Awesome advice. And I agree. I mean, that's where it's what's allowed, I think, in your case, to have the results you have, and what you can continue to have and still expand into as you get more of your autoimmune, your body under balance and in balance. And so yes, as you keep building on that, I mean, that's you've done such great homework. So I want to congratulate you for all that too. And thanks for sharing with everybody.
Thank you.
For those of you who do have questions, yeah, of course. And there's, Katie is so willing to share and open up. So I'm not sure if I am overstepping, but if you have questions, shoot them by Katie.
Yeah, feel free to reach out to me. Yes, absolutely. I would love to help and answer questions and help support you if you're, in the same position that I've been in.
So recently she's gone out of her way to help a mom that was in an accident and help them to get breast milk. But that's me being Katie's cheerleader to realize that she's got such a big heart, and she's been an incredible worker for the client she just spoke of, who is near and dear to my heart, who has also been, he's had some challenges in his life, his whole life, and will continue as a result of some things that transpired in his life. And so Katie has been a godsend for him, and caregivers that have come in and out of his life have been special, but she is one of the most special that has served him. And it is warming to my heart to see her care for him like she has. So of course I would offer my hand to Katie, knowing how she has helped this kid's life and what kind of role she is in his life. I'm going to do everything I can to make sure she is as healthy for him, let alone herself.
Thank you.
So it just started by me just paying attention and going, you were pretty awesome at taking care of this boy. How can I help you keep doing what you're doing so well?
And I think that's kind of how it sparked, was, hey, you're doing such a great job taking care of him. And then I kind of let you know what was going on with me, and you're like, we got to get you healthy. You got to be able to be around for this boy. And this was prior to before I had my own son. And so I was like, and my job is my passion. I know, and, it's a lifeline for me. I love going to work. I love my job, and
you're amazing at it, Katie.
You're
just amazing.
Keep me being able to keep going to work is awesome.
So, well, thanks so much. There's a lot of love and affection going on here. So I appreciate you equally and everything you do. So thanks so much for taking the time to share. If any of you have questions, don't hesitate. Otherwise, I will publish this on the podcast too eventually. And hopefully, if you had Crohn's or IBS or colitis or ulcerative colitis, that you start asking questions about what foods are creating this inflammatory syndrome, because not only is it extremely, sadly, too common, the prevalence goes up. And once you have an autoimmune disorder, unless you're making lifestyle changes, the likelihood in 10 years goes up to 100% that you're going to add another one. So why is it urgent for Katie doing what she's doing? Why is it important for holistic healthcare providers to educate their patients? It's so we're not continuing to give the immune system a barrage and just weaken it by injecting something and allowing the inflammatory conditions that are assisting in creating more of it to perpetuate. So my heart goes out to any patient that's willing to make changes in their life like Katie has done that aren't easy. By the way, last thing, what was the most difficult change you've had to make? Because you've made a bunch.
Drinking the clear bite. There's something I have to drink, and I had it on my kitchen counter for like 3 months, and I was like, I can't get myself to drink it. And finally awesome. I was like, Katie, this is all in your head. You need to get over it. And I drink it every day now. Like, I can't wake up in the morning and not drink my little 4 ounces of the clear bite. And
that's awesome.
That has done amazing things for my body as well.
Well, congrats. Good job. Love it.
Thank you.
Thank you much for listening to this week's episode. I look forward to any feedback and or questions you might have. Direct them to our Facebook page, Frankly Speaking, Dr. Wade at Facebook. Okay, my fellow health warriors, it's time to head over to iTunes, franklyspeakingdrwade.com. There, you can rate, review, and subscribe, as well as share so more of our brothers and sisters can grow to realize their voice. Speaking up means you matter. So, get on it. This podcast is for information purposes only. The statements and views expressed are not medical advice and are not meant to replace the medical advice of your doctor. This podcast, including Dr. Wade Annenson and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about the guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for such services or products. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.